Welcome everyone to this TechNet webinar. Today we are happy to welcome PATH to discuss electronic immunization registry implementation in the view of its end users. Before we start, please note that this webinar is being recorded and the link to the video as well as the presentation will be shared by email to everyone who registered after the webinar. Feel free to ask your questions by typing in the Q&A box or the chat box during the webinar. Questions will be answered after the presentation. Without further ado, let's start this webinar session.
Good morning, good afternoon, and good evening. Welcome to our webinar, Electronic Immunization Registry Implementation in the View of its End Users. This is the sessions among our series to share experiences and lessons learned from A to Z of the EIR implementation in Vietnam, from the design, development, deployment, and paperless transition of an EIR. In this session, we will explore and evaluate the National Immunization Information System, the NIIS, from the perspective of immunization staff, the ultimate users of this system. Before we begin, I would like to introduce our presenters. Dr. Huyen, Deputy Director of the Vietnam National Expanded Program on Immunization. Dr. Nguyen, PATH Vietnam Country Director. Mr. Sang Dao, Ideal Vietnam Team Lead, and Ms. Tu Nguyen, Ideal Vietnam Program Officer. This webinar is pre-recorded to ensure quality of the sound, images against any technical issues with the bandwidth or connection. There will be a Q&A session following the video, and we are here online to welcome all your comments and address all your questions. For those who have not attended any of our previous webinars, we will start with a brief introduction on the NIIS. The two following sections will present our two newest lessons learned. The first one is the challenges of immunization staff at NIIS was first introduced and how they overcame those challenges. The second lessons learned will delve into the views on how the NIIS impact their day-to-day work, from workload to work quality and efficiency. And finally, we will close with our recommendations, and then there will be time for Q&A afterwards. Launched nationwide in 2017, the NIIS has been utilized in all 63 provinces by currently about 15,000 facilities and hosts a database of 27 million clients, both children and adults. With the current launch of the e-immunization cards, we have recorded 121,000 accounts created by parents to follow their children's immunization records. NIIS is a web-based system similar to any EIR system. The main function is the Immunization Registry. The system hosts information of clients, both children and adults, at the individual level, with the ambitious goal to follow their immunization record from birth to disease. When a child is born or comes in for vaccination for the first time, they will be entered into the system. From then on, every shot will be recorded on the system and tracked nationwide. This database can be accessed on any device, laptop, computer, smartphone, tablet, and anywhere with internet connection, whether they are coming for their shots at the hospital, community health center, or at fee-based immunization facility. With the system and its valuable database, we were able to develop some of the main features to support the users, including barcode scanning, easily identify clients, help with client searching, avoid duplication, and filter out fake ID. SMS reminders will be sent out to clients who are due to their next shots with information of time and location for the next available immunization session. Immunization tracker and planning. Support the immunization staff in planning for the immunization sessions, especially useful for community health center with monthly fixed date for immunization. Dashboard and reports. Support the immunization staff in their monthly reports to the upper levels and to have a more comprehensive understanding of the current immunization status in their localities. From there, they can make data-driven decisions on appropriate activities and campaign for immunization program. An e-immunization card, as mentioned earlier, is a newly added and recently launched function which serves as a digital tool to replace paper immunization card. It's a mobile app that give parents or clients access to their children's immunization records so they can be more proactively involved in tracking and following up. It's also a direct channel of communication for parents to their immunization staff. And this is just a beautiful login page for the NIIS. However, systems that suit their intended uses and users don't just happen. They are essentially products of a user-centered development process and a user-centered attitude during the implementation of a usable system, systems that support and engage users rather than get in the way and hinder them throughout time. Likewise, NIIS have continued evolving to stand the test of time and bear the weight of users' criticism. PATH worked closely with immunization staff at all levels at piloted localities to identify and focus on these real users and their needs, goals, context of use, ability, and limitation to drive the development. It has been a decade-long process of growth, adaptation, learning, and overcoming challenges from both the NIIS and the immunization staff to bring about a system that truly serves users not only on their daily tasks, but also the overall national immunization program. The next section, we will explore the challenges that our immunization staff faced when the NIIS was first introduced and how they overcome these challenges. From this, we consolidated our lessons learned for others to consider in the process of EIR introduction and transition from the existing paper system. This document named Overcoming the Challenges of Innovative Technology Adoptions for New Users and Electronic Immunization Registries Implementation, a case study from Vietnam. And it can be accessed on our TechNet 21 landing page with the link attached. We will first discuss on the challenges for immunization staff at facility level. This includes staff at community health center, hospital, clinics with birth room, PDA's immunization facility. The first two challenges were identified early on before the launch of the system via readiness assessment. Number one is insufficient infrastructure, such as electricity, internet, computer, printer, barcode scanner, and so on. Infrastructural capacity has been the limiting and deciding factor for the design and development of the EIR in Vietnam. The system was going through a period of different platforms depending on the availability and accessibility of internet and computer. Number two, lack of computer and system skill. Here's the quote from one of our immunization staff when was asked about the NIIS. Being introduced to NIIS was also the first time I was introduced to the computer. I didn't even know how to turn it on and off or where the power button was at. And to these immunization staff, the NIIS was a whole new field of technology, equipment, and system, and even a new way of life that they had to learn to adapt. Implementers can address these challenges by developing a system with user-friendly interface that was easy and simple to learn and use, developing standard operation procedures for immunization on NIIS functionalities, planning for ample trainings of trainers and cascade trainings to follow, developing thorough guidelines materials, and providing 24/7 technical support from district, province level, as well as PATH, and especially hotline from Viettel, technical partners develop NIIS, and it can be utilizing online tools and support virtually as needed. As the immunization staff struggle with multiple tasks in their facility, introducing the new system added more workload to their daily tasks. The hardest period came in at the initial and the transition phase. as they had to attend a lot of training to equip themselves with the knowledge and the skill set needed for the system. And many of them started from the basic computer training. This made training period especially long and demanding. They also had to perform the labor-intensive and tedious task of data back entry, which many of them had to bring those work home to ensure the timeline of completion. And as the paper-based system is yet to retire, dual system create double work for the immunization staff. These challenges are unavoidable for any system introduction and transfer. Thus, it needs a recognition from the upper level to allocate appropriate human resources, time, as well as task management in their planning to uphold the quality of those tasks. And lastly, our immunization staff experience the challenge in the system itself, which is still under frequent update, and thus require the staff to keep up with the new functionalities. And for the immunization staff at fee-based immunization facility, interoperability between NIIS and their existing system remain the most important challenge. This requires further coordination between private sectors, the NEPI, and the system developer, Viatel, to work out the mechanism for data transference between systems. At the management level, the immunization staff face challenges at different scale, with the two main categories of resource management and data management. Understanding the limited resources available for lower level staff, they have to look at different ways to mobilize computers and different equipment, such as printer, barcode scanning, to accommodate the system requirement. In regards to workforce capacity, besides training, they also had to build themselves as a role model and a champion in NIS usage, provide on-call technical support, and act as liaison between the end user and the technical team. On the data management aspect, ensure data quality and enhance data use on NIIS are an ongoing challenge that can't be overcome in a short period of time. Continuing training and learning will pay off in the long run. And I would like to end this case study with a quote from our interview with a provincial immunization manager. EIR is inevitable in this age of information technology. It is the obvious next step in data management. I can clearly vision the benefit of NIIS and fully support the system. Now, that's the main attitude from our immunization staff that helped them in overcoming all the challenges after NIIS was launched nationwide. The next part of our webinar will be talking about how NIIS affects the workload of immunization staff, and we've touched a bit in the previous section, as well as the efficiencies of immunization program. And this document named Electronic Immunization Registry and Workload Reduction and Efficiencies Enhancement for Immunization Program in Vietnam. Again, this can be accessed on our landing page on TechNet 21, and the link is attached. Now, at the commune health centers, where child immunization is conducted on a monthly basis on a fixed date, planning for these immunization sessions can be a painstaking process. The flow chart on the right describes the workflow for immunization staff before and after NIIS is introduced, where a large part of their work can be automated based on the database and the algorithm program in the system. Observational study and in-depth interview show that the 3 to 5 days labor-intensive job can be reduced to a 30 minutes or 2 hours planning max. The report module on NIIS also showed the significant reduction in workload for immunization staff who were burdened with compiling timely and accurate reports after each session. Again, the time consuming for reporting reduced from a day to 30 minutes. And the system can also automatically send report to upper level management. I particularly like the quote above during our interview with Commune Health Center staff, as it included some very descriptive details of their job that many of us didn't realize or appreciate. Now, different commune health centers would have different ways to complete their jobs, but in general, the paper-based system required lots of time and effort from the healthcare staff to do the administrative aspect of the job. However, as mentioned in previous lesson learned, to get where the system can fully reduce workload of immunization staff, the process of learning and adapting to the new system needs to be recognized and planned accordingly. At the management level, many of the burden on report collection and consolidation have been eliminated as the system gives upper level EPI manager access to the data as needed. Now that has shifted toward technical support for the facility level, as many of them require further training or simply encouragement during the transition to the paperless system. Furthermore, frequent supportive supervision was also added on to ensure newly implemented system functions seamlessly. Data management is also a new domain for EPI managers to train on and to expand their capacity in improving immunization program management. Available data offers this prominence and tremendous benefit only when our immunization staff can ensure the data quality and effectively analyze those data for decision making. Data used and data quality are essentially affirmative and supportive loop. The more data usage, the better data quality, and vice versa. Again, I would like to end this section with a quote from provincial EPI staff that we asked on the data available on the NIIS. What they say, our work would be more focused and efficient. There are more I think we can do with data on the system that I have yet to learn. Vietnam immunization staff are now offered with the tools necessary to improve the performance of their national immunization program and at the same time reducing their day-to-day administrative workload and focus more on their clinical aspect of their work. And lastly, we are bring to the end with our recommendations based on these lessons learned. It is essential to employ user-centered approach in design, development, and deployment of EIR system. And here are what we consolidated from our own experience in Vietnam, what those user-centered approach would include. Number one, developing a system with user-friendly interface that was simple to use and easy to learn. Number two, developing guideline SOPs for immunization and vaccine management related work based on NIIS functionalities. Number three, planning for ample of trainings of trainer and cascade trainings to follow, with a requirement of at least 2 health workers from each commune health center, coupling one young and computer savvy health worker with an older one with more experience in immunization to complement each other. Sufficient training and sufficient time are needed for staff to get familiar with the system and use it efficiently. So it should be allocated specifically depending on the computer competency level of staff. And this will help to reduce workload related to data back entry if users are familiar with the system. Number four, providing 24/7 technical support from district and province level, as well as PATH, other partners, and hotline from Viettel, the technical partner developed NIIS, utilizing online tools to support virtually. And number five, now the most important approach to overcome all challenges came from immunization staff themselves. After launching the NIIS and during training session, we quickly identify among learners the NIIS champions who show their curiosity on the system, enthusiasm to learn, and willingness to explore. Together with the system mandate from MOH and the support from higher level and technical staff, these NIIS champions were the influencing factor that helped promote the acceptance among immunization staff. With all their effort and patience, they overcome their initial resistance and were open to change. And they learned that computer was neither rocket science nor a hurdle to climb over, but rather a helpful tool to utilize. Number six, implement e-learning system to provide knowledge and skills of health staff about updates, increase knowledge, skill on using functions of the system, as well as maximize utility of data on the system for management and decision making. And lastly, number 7, develop clear standards of procedure on API guideline for fee-based immunization facility to exchange data between their own system and the NIIS. Involved via tel once the two systems can't be synced smoothly. The fee-based immunization facilities engagement in the NIIS will increase, and that would increase the completeness of the whole database. Now that would be it, and thank you for your attention. We are looking forward to your comments, questions, and suggestions in the Q&A session follow.
All right, thank you very much for this presentation. Before starting this Q&A session, I would like to mention that Dr. Huyen couldn't join us tonight, so he won't be participating to this Q&A.
But we have Dr. Nga here, would also be able to take over any questions and related to more government concern. So I see a couple of questions by Nicholas Danielson. Thank you, Nicholas. And I also see Mr. Sang has been answered your questions. There's one remaining questions on asking where is the NIIS database store on a physical government server in Vietnam or on cloud. And Samuel, would you like to answer this question, please?
Yeah. So that the so now we actually started the NIIS. We have a Viettel the company started the ME started the company under the management of the Ministry of Defense. There is the support MOS to develop the NIIS, and now the database is stored at their physical the server. So and they also host and they secure the data and they support to maintain and operate the NIIS.
Thank you very much for this answer.
I think still there is one remaining question from Nikla about the difference between common health worker and village health worker, and can village health worker able to start the child record themselves in the NIS? So Sang, would you like to answer that?
Yeah. So that is the for the in Vietnam we have like the community health workers. They work at the community health center, and the other that the every the village. So we have village health worker. There will so we have a village health worker and the village health network. In each village we have one the health worker to support, and they can help to collect the data, to monitor about the outbreak in their village, and also the something like the event, the health event, and they also the support to collect the data about the newborn in the village. If the newborn is born at home, so they can collect the data and they inform to the community health center, and the community health and community health worker they can enter the data, register the newborn into the system, and then after that the system that can help them to send the SMS, remind the parents about the immunization together in the community.
I think we have another question from Dr. Zultham about the policy to mandate this NIS to the whole immunization system in Vietnam. So I can answer this question. So as you may know that NIS was launched by Prime Minister in March 2017. And since then, that there are several policy documents issued from Ministry of Health, either from the Prime Minister or from GDPM about the mandate NIS to use as an information system to capture on immunization data in Vietnam. And even that they have one regulate, not regulate like the policy document to say that since last year, that's all the system should be used like a paperless system for the immunization data for the whole country. However, Ministry of Health mostly just have a document at policy level, but not at the lower level of implementation guideline, SOP, to instruct the health worker at lower level how to process to paperless system. So that's why IDEO project have came and provide support to national EPI, NEPI to develop the guideline, technical guideline, also SOP to ensure data use and data quality, also to give the instruction for the health in Vietnam. Over.
Yeah, thank you. And I think there's two more questions from Razat. And I think this can be directed to Sang. Razat is asking, can system-generated phone calls go to beneficiary to reminder? Or there can be a single number for calling and get an immunization information? Sang, please.
For this question, so for the NIIS, we just like to send the SMS to the to send SMS reminder to the parent, remind them about the immunization schedule in the commune and what kind of the vaccine that children need. So we do not like generate the phone call. Yeah, so we just use the SMS, and now we are working with the community. We are piloting the immunization card. So if the parent they have a smartphone, so they install the e-card on their phone, so they can receive a notification, but not a phone call. But sometimes the health workers like the NIIS generates a list of the defaulter for the immunization. So on the list, they have the phone number, so that the health worker can make a phone call to remind the parent. In case that they don't like they don't receive a SMS, or maybe that they miss SMS reminder.
Thank you, Sang. And I think there's Razat also asked that can it be linked with telecalling?
Actually, that is the for this question is I think that is it. I'm not sure that I understand the 100%, but it's like for the system they just like so the health worker they just can see if they use smartphone, so they can see the location and what kind of the vaccine from the notification, or if they have a feature phone, they can receive a SMS reminder and they know the information. But they know about what kind of the vaccine their children need. But they don't have the phone call. They can contact directly with the health worker. They have a telephone of the community health center. They can call directly to the community health center.
There's two more questions from Nicholas Danielson, and I think it's regarding the information on NIIS. What information reported, and if it's including the child household, if it's possible to disaggregate coverage by social, economic, household strata. So this is more of data analysis. And also Nicholas was asking if parents have access to their own child vaccination record in NIIS. And Sang, could you help with these questions?
Yeah. So for the question about the household socio-economic the data, we don't in the NIIS we do not record this kind of the data. So in the NIIS we just collect about the location, geographic, we can analyze the geographic, ethnicity, and also the by gender, and that there's something like that, and we yeah, just something like that. We don't have socio-economic data on the NIIS. If we if the government or the local government, they want to they want to analyze the analyze the data immunization coverage by socio-economic household, so they need to collect the more data and analyze. And for the second question about the parents able to access their own children's vaccination records in the NIIS, we can say that yes, if the parents they use e-card, so they install e-card in their smartphone, so they can access to the vaccination record from the NIIS.
Thank you, and Sang. I have a follow-up question regarding to the telecall and the helplines. Razak has elaborated more. He meant to say if there's a single helpline number that linked to the immunization record. So let's say if he called from his number, then he can get information about the due vaccines for his child. And this may have impact for urban population where the health workforce is scanty. Would you have any comments on this suggestion on the helpline for immunization, Sang? And if it would be possible to integrate into NIIS in the future?
Yeah, I think that we at the beginning to develop the system, we also think about integrate with the telephone, the number that they can the calling center that we can support for the parents, that they can make appointment, or they can update about data, the immunizations, the event, so what type of vaccination that their child got from the any facility, and also we use that calling the center for the program like event-based surveillance system. But I think that is it seems that is quite complicated for the pupil, for the parent. They know they understand about and the transcribe the voice into the data. I think that is it's not feasible, quite complicated for the implementation. So do we suggest that they can use the e-card. So now that the number of the people they own the smartphone is quite high, so they can use the e-card on their phone.
Yes, thank you. And next question would be, on average, how much training time is needed for a new user, such as a commune health center, a commune health worker, and a village health volunteer? Currently, are there still any difficulties for end users with regard to technology application?
Yes, for the end users who from our experience, we usually provide one-day training for the end user, for the health worker about the basic function of the NIIS, like how to register the newborn, what type of information, and how to check the application, and how to create the vaccine transactions in the system, and how to view the query, the report, something like that. So we take the one day for the training. But that is like the people with the health worker at the community level, they're very limited the knowledge and skill about the computer use or technology. So that is after 1 day, they need the fresh training, and they need a lot of the technical support, the on-site technical support for them, like provide the on-the-job training, so they can understand more about the system. Yeah, so that is why we we think that the 1 day is not enough, just like provide the about the basic function of the NIIS. And if you want to they understand well and they can learn again, so we develop the video and we upload the video to guide them how to use the NIIS. We upload to the e-learning the system, so they can access to the e-learning the system, and they open the video and they learn about the NIIS, how to use that.
Thank you. And I think this next question is also related to the time. Nicholas is asking, how much time does it take for a health worker to start a new child record in the NIIS, including entering the child name, date of birth, parent's name, resident, phone number?
I think it depends on, it depends a lot about the just skill. For example, like after the beginning of time, they are not familiar with the NIIS, with the new user, they just learn about the NIIS, and the skill is not so good, so they may take the 1 or 2 minutes to enter the to enter the personal information, like a name, date of birth, gender, and the caregiver name and the telephone. So they take the 1 or 2 minutes to enter register into the system. But now they just take the half minutes or minutes, and it also depends on the internet connection. If the internet connection is good, so but sometimes they enter and they click save but the internet connection is not so good, so they have to wait. They have to wait for the system to respond that the old data is saved successfully, something like that. But usually it's now for the 3 months of use the system, so they just take the half minutes to enter data.
Thank you. And the next question also by Nicholas, asking if the nurse and the midwives in health facility and hospitals start child records in NIIS before newborn children are discharged from delivery wards. I guess I could take this one too. Nicholas, actually, yes, NIIS is also available for nurse, for health worker in the hospital. And usually for newborns, they would register newborn prior to their first shot, the hepatitis B birth dose. Okay.
All right, so I'm going to have a few more questions for our panelists here. The first one would be, one of the challenges you mentioned was back data entry when you introduced the system. Can you provide more details as to why was back data entry needed? What is its role for the implementation of the EIR? And what information did health workers have to enter into the system?
I think Dr. Nga, would you like to take on this question?
Yes. So I can take that question. That you know that one of the useful functions from NIIS as planning and also generating the immunization report. So that's why you need immunization history data. For the system, when it's just newly launched, we not only need the data for the current immunization section, but also we need the back history for the last 2 years, especially for children who has not completed their vaccination schedule. So it is helpful for system to generate the list for the children that's the due date for vaccination, and also to generate the data for the immunization. So that's why we need to enter the back the data, and that is one of the biggest challenge when we just introduce the system to the health worker, because from the beginning they're not really familiar of using system, so they very hesitant to do that, but it's very important. And also that the all of information the data enter to the system is similar to the current data that capture in the system, that on demographic information for the child, name, address, the name of parent, date of birth, location, also the immunization history. So that's all my information captured in the system. Over.
I see there's a question. I think chị Nga can help. Dr. Nga can also help answer this. Can private immunization center join the system? What is the structure and brief to manage private center?
Actually,
yes,
that,
yeah, okay.
Yes, Sasan, please go ahead.
Yeah, I can answer this question. Actually, that is the, like in the management, the infrastructure management in Vietnam. So private immunization center or the facility, they under the management of the other agency that we call that the provincial health department. So that is the but the in the regulations, the policy, the NIIS policies, they require the on the private immunization center have to enter the data. You know that in Vietnam, to private immunization the facility, they have their own the system, and we create the API so that the to support them can exchange the data from their own system with the NIIS to reduce the duplicate the data entry. At the beginning, we at the beginning of the implementation, the private immunization center, they have enter both in their own system and also on the NIIS. So now we develop the API so to support them to exchange the data. So they just enter data in their system, and that is the exchange data with the NIIS.
Yes, and another question from Nicholas. Does Vietnam have vaccination status check for children at some time when they grow up, for example, at school start? If yes, are the NIIS records used for the vaccination status check? Can I help answer?
Yeah, I can take that question. Actually, it's not like a policy from Vietnam government that is requires vaccine to show vaccination status for the school start. However, that we can use the NIIS record for many other purposes, but it's not required to show the evidence at the school start in Vietnam.
Okay, so we have another question here that would be, do you use the NIIS to track COVID-19 vaccination in Vietnam?
At this moment, that because two different target population for COVID-19 vaccine and for NIIS. So NIIS mostly just focus on children under 3 years old and also pregnant women. While COVID-19 vaccine is for on adult from 18 years old and above. So different target population immunization schedule. So at this moment, NIIS is used for capturing the data for vaccine checking, for COVID-19 vaccine checking. For the immunization data, COVID-19 immunization data, at this moment, Ministry of Health is using other system for them, namely personal health record, also developed by VietHealth, same group that who maintain NIIS now, and a different system. But in the near future, it's a plan from Ministry of Health that they will integrate the NIIS system with the COVID-19 immunization data system into one. Over.
Yes, thank you, Chị Nga. I love this question from Nicholas. Do you ever
use the NIIS data for VPD, vaccine preventable disease outbreak investigation, for example, measles outbreaks? And Sam, please.
Yes. From the NIIS, social managers ask from the districts up to the province, regional, and the national. They can use the NIIS to see the coverage of the immunization by type of the vaccine and also the fully immunization. For example, like the measure, they can use the system to see the coverage and where is low the coverage and what kind of the what group community group with the low immunization the coverage they can access and they can see and they can list all the children in the one cohort who are not vaccinated measure something like that. So they can use the NIS to evaluate or assess the risk of the outbreak in the community. They can use that.
Thank you very much for this answer. The next question is, interoperability is very important for health facilities exchange data, but how do you secure the privacy of data?
Yeah, I can take I can answer this question. To protect the data privacy, we apply different methods like user authentication to establish the different access level for different user, like for the different level, like a commune and district and province, they have different access level that we ensure to ensure the appropriate personnel access to appropriate the information, like the community health center. They can access to this system and they can create the newborn, and they can export to the list of the children in their commune. But at the district, they just see the information. They cannot export and they cannot register the newborn in the system. So that we use the we use the authentication the method, and also the besides that we the NIIS advocate for MOS to issue the privacy and data protection policy that regulate about rights and responsibility of the facility in protecting the data privacy, data completely why they use the system, and also that during the training, so we also enhance we create the awareness of the end user about the importance of the data privacy and how to protect the data in the training for the end user. So that we increase the awareness of the end user about the data privacy, and also we use the policy to regulate them, and also we use the system with the authentication, different method to protect the data privacy. It's over.
Thank you for this information. The next question would be, since data entry into the system is compulsory for all facilities in Vietnam, why do you still keep a paper-based system?
Yes, so actually it's still a little bit confusing at this moment in terms of policy framework for that. OI Ministry of Health issued several documents to indicate that the transition to paperless system is important for immunization data, even for other health information data. However, it's not really like a concrete guidance and policy guidance between the requirement for paperless system and the requirement for the auditing purpose for Ministry of Finance and also from the Department of Finance and Planning at Ministry of Health. They still require some form of paper-based for regular monitoring, auditing, annual audit, something like that. So it's really, so that's why mostly that provincial level and now they hesitant to give up the paper-based system like immunization letter, vaccine letter, because they felt that at some point auditing team may come and they found that no paper-based, no proven recorded to the other immunization activity at the common level. So that's why they still in parallel system. However, in some specific province, especially that Sơn La province is under support from IDEO project, they really go advanced for that, and they really haven't used immunization letter for a while, for a year or more than a year. They just enter the data from the system, and if whenever needed, they can print out all of the data from the system and keep it as a record, but they don't use a paper-based form to record the data. Over.
Thank you so much for this information. I think this was our last question, so I would like to thank you for this very interesting presentation and for taking the time to reply to all these questions. I would like also to remind all the participants that this webinar was recorded and that you will receive the link to the recording and presentation by email in the coming day. We will also share some more links to go further into the topic, as well as contact details for you to keep the conversation going. Finally, I would like to add that TechNet is going to organize a webinar series on LMIS. We will tell you more about it on our platform and social media channels, so for anyone who is interested, please stay tuned. On this note, I am closing this session. Again, thank you to our panelists for your time and for sharing your expertise. And thank you to all our attendees for your participation. We look forward to having you on another webinar. Have a nice day, a nice evening, everyone, and goodbye.